you very much, Mustafa, and thank you, Jim, for inviting me to participate. I've really enjoyed participating in the other sessions. I've learned a lot. It's a pleasure to hear many of the speakers. It was great to hear Kingsley speak. I really have learned a lot. I don't know a tremendous amount about Pakistan. I've never visited before, but I'm really interested for learning more. The biggest experience I had with Pakistan is many years ago. I flew on Pakistan International Airlines from Washington D.C. to Paris, and I was probably the only one on the flight who was not Pakistani. And I made a lot of friends on the flight. People were very friendly. They were barbecuing on the plane. They were kids running around. I felt like I was part of that culture. And so I'm looking forward to visiting sometime. Um, I'm really glad to be able to speak to you today about the role of the media in responding to the pandemic. I've been doing a lot of thinking and writing and speaking about this issue. I take a very global perspective on health communication. I coordinate a large international research program on the dissemination of health information. I'm in about 15 different countries right now doing national surveys on where the public gets health information and how they utilize that information. And since the pandemic started, there's been increasing interest in getting information about the pandemic, about the risks involved. And I found through a lot of the survey work we've done that there are tremendous similarities across countries. But probably in the US, we have had the biggest problem with the media coverage of the pandemic. So let me launch into my talk. Um, the main issue is that pandemics like this one are extremely complicated. They're dangerous. They're difficult to respond to, especially when it's a new health risk. We don't really have the information we need. So the media are really essential for disseminating relevant information to reduce confusion, to try to help people understand what we're up against, to share relevant information, to provide rationale for decision-making and actions like prevention behaviors, to empower management of health risks, to help coordinate response, and then to integrate practices and policies, not only for now, but for future. One of the things we've learned from the past is that pandemics are not a unique event, but that we've had a long history of serious infectious diseases. And so we need to think about how we need to respond. And so there are three primary things that I think that we need to think about in terms of media coverage. How is the media increasing public awareness, not only about the nature of the problem, but the seriousness of the problem? And that was a really big problem in the US because for a long time we were underplaying the importance and the seriousness of this problem. We were representing it as a minor issue, something that we did not have to worry about, something that was not even as dangerous as the seasonal flu. And that was a huge problem because the media were discouraging people from taking this seriously. The next major thing is to deliver relevant and timely information, especially as we get updates. When we have a pandemic like this one, where there's a new issue, we don't have all the information. But as it goes on, we learn more. We develop new strategies for treatment. We learn more about the best prevention strategies. We learn more about the ways that the pandemic is being spread. And the media need to provide those updates so that people are not making their decisions based on old information. But we had a number of really dangerous conspiracy theories and myths about this pandemic that were hard to break. And the new information was not coming through. And then the last thing is that the media needs to promote coordination. When we're dealing with a pandemic, we have a lot of different groups of people that need to work together. First responders, policymakers, healthcare providers, people in the military, people in the media. How do we get all these people to work together and get on the same page? And we've not done a very good job in the U.S. with that. Later on, we'll find out how well this has worked in Pakistan. I see three primary functions of pandemic health risk communication. The first one I list is prevention, because I think that prevention is the most powerful response to any health risk. No matter how good your response is, if you can prevent the risk from coming and beginning, it's better than any good treatment or any kind of vaccination. But we did not do a really good job of preventing the virus from spreading in the U.S. We had a lot of information because the U.S. was not the first country that was hit by the pandemic. There was a long history of the pandemic in China, in South Korea, in a number of Asian countries, in Europe, before it came to the U.S. And we did not heed that warning very well. There was kind of a hubris, I think, of people in the U.S. thinking that this was something that was happening to other people but would not affect us. And because of that, we did not engage in prevention behaviors. We didn't start developing stockpiles of equipment. We didn't start designated treatment places. We didn't start building policies. We didn't engage in educational efforts. And because of that, when the pandemic began to spread, we were not very well prepared, which leads us to preparation. If you can't prevent the pandemic, the best thing you can do is prepare. And since we know that pandemics occur on a regular basis, and we have had a long history of very deadly pandemics over the centuries, over the years, that we need to start developing targeted strategies. One of the primary goals of the CDC, the Centers for Disease Control and Prevention, is to identify major health risks like pandemics and to prepare for them, and to identify quick responses to developing testing mechanisms and to developing treatment strategies and to develop vaccines. But the CDC has been going through a lot of turmoil, especially under this current administration, where funding has been cut, where leadership has been forced out, where political appointees who don't really understand the mission of the agency, don't have a lot of history, are calling the shots. And there's been a lot of intimidation. During the Obama administration, the previous administration, a specialized pandemic response unit was established. It happened during the H1N1, virus. And as soon as the Trump came into office, it was disbanded. It was cut back. It was the funding was cut. It was dismantled, and that left us very vulnerable. There was not a lot of attention spent on developing the stockpile of preventive equipment and respirators and other tools that we knew from past coronavirus problems we would need if this happened again. And so we were not well prepared. And then the third thing is the response. When the pandemic hits and people start getting infected, we need to think about ways to treat them and to mitigate the problem. We need to kind of get different public groups involved in ways of preventing the spread, of responding quickly, of identifying people at risk, of developing and monitoring what's going on so we can make plans. But we had a really mixed response to the pandemic, where we were not collecting information, we were not responding to information. And part of that was a lack of respect for health science and epidemiology. And there was not a lot of good planning. So the media failed, I think, at all three of these major factors. So here's a kind of a picture of what happened in the US. The major news media like the New York Times, the Washington Post, USA Today, Forbes, actually did a pretty decent job covering the pandemic. I read the New York Times and the Washington Post every day. I found it very informative. They provided good information. They based their information on major sources like the World Health Organization, the CDC, major research centers, Johns Hopkins. They had very good information. But we're in a kind of a strange situation with the media in the U.S. and maybe across the world, where these traditional media sources are not given as much attention as they have in the past. They are not as powerful as they once were. And instead, a lot of politically motivated fringe media, and here in the US, Fox News is a good example. There's a number of them, Breitbart, US One, that spread dangerous misinformation and are becoming increasingly popular. So instead of reading the newspapers and paying attention to the major sources, Americans are looking at less in-depth and often misleading information. Worse, major political figures, and in our case, in our country, President Trump and his minions, the people that work for him, like the people he appointed to lead federal agencies, have consistently attacked traditional mainstream media. Said they were the enemy of the people, said they were spreading fake news. They censored and disparaged health experts. Even when they added experts to their coronavirus task force, they wouldn't let them speak. When they said things that did not fit with the president, they were banished. He would not allow major leaders of different organizations like the CDC to testify before Congress, to be interviewed. He cut our relations with the World Health Organization in the midst of a deadly pandemic. Basically, they were really geared to undermine science. And I think the reason was because the science did not support the worldview and the perspective of the political party. They were more focused on the economy and thinking that they could kind of power through the illness and keep, making money without really recognizing that when people were getting ill, it was going to have a huge effect on the economy and limit our ability to achieve our goals. Even in the official pandemic press briefings, rather than using them as an opportunity to provide updates and accurate and recommendations for mobilizing behavior, they were used to spread dangerous and inaccurate information. Most of the early press briefs were saying, we have this under control, we're doing a great job, there's no problem, don't worry about it, there's no need to engage in prevention behaviors. And a lot of the major political figures were not really demonstrating and illustrating the correct behavior to engage in. So they were counteracting good messaging. So we had a really bad problem with media coverage. While there was good information available, they were not working very well. One of the big issues in the US that really caused this problem was the growth and power of social media. So we have a very complex, multifaceted media landscape in the US with many different pieces. And the attention to different channels and sources has been shifting. And in recent years, social media have become more powerful. So there's some really great things about social media. It's a very democratic medium where everybody has a chance to speak. We can reach a lot of people. It's interactive. We can have discussion. But the problem is that they're becoming a dependence on very specialized social media that reflected the worldview of different audiences. There's been a tremendous growth of conspiracy theories, a lot of misinformation, and even worse, disinformation, where people were spreading rumors and information that supported their perspective. There's a kind of a social network factor going on. There's a sociological theory about the strength of weak ties. And it says that people can learn a lot by paying attention to people with very different perspectives. But in social media, people don't do that. They seek out people who are a lot like them. they kind of confirm their own biases. There's a confirmation bias theory that says that the credibility of sources is enhanced by the closeness, cultural closeness of their perspectives and backgrounds to yours. And so people were kind of identifying with different political groups, and there's a lot of specialized social media that reinforce information and don't provide new perspectives. Kahneman, a Nobel Prize winner, had a wonderful book about fast and slow thinking. And he says that slow thinking is a particularly appropriate strategy for dealing with complex problems, because you need to think things through. You need to really evaluate and elaborate on what's going on and try to figure out what's happening. But it's complicated and it's difficult. So people have become used to making quick decisions, not elaborating. And a lot of the social media would provide easy to understand, but inaccurate information that people would pick up with. They did not want to think about the complexity of science. They didn't like the idea that things were changing and there was a lot of probability this could happen, that could happen, that people wanted easy answers. And the social media promoted simple, quick thinking and not heavy elaboration. There's a wonderful model called the elaboration likelihood model that talks about the different ways that people interpret information. There are times when it is appropriate to do low elaboration thinking, not really pay attention when problems are simple and routine. But when problems are complicated, we need to really step back, and we need different sources of information. We need to look at different perspectives. And so the media becomes a really powerful source of these new ideas. But if people are not paying attention to the different sources of information, it undermines that ability to elaborate and think clearly about the issues. And so there's a lot of really poor decisions being made based on media coverage. So one of the things I've learned is that it's really important to study the media to figure out what are they doing? Where is the information coming from? Who do people pay attention to? What messages seem to be resonating and getting out to people? What influences have different media sources and strategies used? How can we engage in more strategic health communication? We realize that we don't need to communicate the same way to everyone, but we need to focus on different audiences. And what are the best ways of communicating with those audiences? Which means we need to engage in audience analysis. We need to figure out what's going on. What did people learn? What unintended effects and negative effects occurred through the coverage of the media? And what can we do differently in the future? So I've been spending a lot of time studying, and in that international research program that I coordinate, we now have a new module about pandemic risk communication to find out what's going on in each of the countries and around the world. This is a model that I've borrowed from the Canadian Cancer Society. I do a lot of work in the area of cancer communication, but I find that it really fits with a lot of issues. It's called the knowledge synthesis model. It says that we need to do different types of research to really develop strong applications and programs to engage in strategic communication. And so there are three major types of research I think needs to be done. Fundamental research, where we figure out what are the basic ways that people use the media. What are the ways that people can understand what kind of messages really reach people? How do we adapt messages to different audiences? Surveillance research, where we track what's actually going on and evaluate how it's working. And then based on both the fundamental and surveillance research is to develop interventions, strategies for communicating that we can test and evaluate, and then combine that in a knowledge synthesis to direct strategic application and program delivery, strategic communication. If we do that, I think that we can have a better handle on how to use the media to address pandemics. So here's my big summary slide. This is the big roll. We need a drum roll here. Pandemic communication research and practice goals. I think we need to develop an infrastructure for understanding and advancing knowledge about pandemic health risk communication. We can't operate by the seat of our pants. This has got to be a very focused strategy. We need to test and evaluate new communication strategies, models, tools, channels, sources, and media to see what works with different audiences. We need to use that to disseminate the most relevant, timely, and accurate information to guide action. And then we need to implement these communication practices and policies widely. This is a process of discovery, development, and delivery. If we do that, I think we can make huge improvements in health information dissemination and do a better job to attack misinformation and disinformation. So here are some key references. I've been doing a lot of writing recently about pandemic risk communication, and it fits into a lot of the work I've done before. So I didn't make up this stuff. It's all there. If you want to follow up, you can look at some of these publications. I look forward to hearing about what's going on in Pakistan as well. Did you have some of the similar problems that we had in the US? Some countries did a much better job of covering the pandemic. They did a better job in New Zealand. They did a better job in South Korea. They did a better job in Germany. But we've had some real problems in the US. So let me